Do you suffer from heavy, painful periods? You could be one of the 190 million women worldwide who have endometriosis, but you might not even know it. Keep watching to discover the root causes of this debilitating disease and science-based options to treat it. According to Yale Medicine, on average, women have to wait 10 years before being properly diagnosed with endometriosis, which is a massive problem for several reasons. First, because endometriosis is not uncommon. An estimated 10 to 15% of women suffer from it. And I mean suffer. Endometriosis can be an absolutely debilitating disease. Endo is a factor in 70% of women with chronic pelvic pain, and it's also a common cause of infertility. This means millions of women go without appropriate and life-changing treatment for literal decades, not only dealing with disabling pain every month, but also suffering the social and economic repercussions of regularly being unable to work, care for their families, and just plain function in their daily lives. The second reason this lack of proper diagnosis is a problem is because the sooner you know you have endometriosis, the more you can prevent its progression. Meaning if you get early treatment, especially if it's root cause treatment, you can not only relieve symptoms, but you may also minimize spreading. In this video, I'm going to share 5 natural functional medicine strategies that you can use to do just that. One of which reduced pain med use by 80%. But first we need to talk about what endometriosis is and explore some of the theories behind its cause so that you can understand how these strategies work. Endometriosis happens when endometrial-like tissue attaches to areas outside of the uterus, growing and shedding in response to hormonal fluctuations. Endometrial tissue is very vascular, meaning that it contains a lot of blood, and it makes and releases lots of hormones and bioactive compounds that are less than helpful when outside of the uterus. These cells can implant anywhere in the pelvic region, including the ovaries, fallopian tubes, bladder, and digestive tract. In rare cases, endo can even be found outside of the pelvis. You can imagine what happens if all of this swelling and growing and bleeding and secreting is going on outside of where it's supposed to, for instance, on the rectum or abdominal wall. It creates some big problems like severe pain, cramping, nausea, bowel issues, painful urination, infertility, adhesions, and tissue damage. While the cause of endometriosis is unknown, researchers and clinicians have recently identified many contributing factors and theories to explain why it happens. What we do know for sure is that there's no way to predict if you'll get endometriosis, and there's no specific diet, supplement, or medication that can prevent it. The endometrial lining of women with endometriosis behaves differently than it does in women without endo. So if you're suffering, it's not your fault, and you did nothing wrong. We also know that there are many factors driving endometriosis that can be modified or improved. The 3 biggest areas where functional medicine strategies can effectively relieve endo symptoms at the root cause are hormone balance, cellular proliferation, and inflammation. First on our list is hormone imbalances. Endometriosis has been known as an estrogen-driven condition for a long time, and for good reason. Endometrial tissue has a higher responsiveness to estradiol. Specifically, these cells have more beta estrogen receptors, which strongly bind to estradiol and drive a majority of the cellular dysfunctions that we see in endometriosis. Now, before we get too far, let's remember that estrogen isn't the bad guy. It's an essential hormone for female health, and it does all sorts of important things, like maintain the strength of our bones and protect our brains from dementia. And without estrogen, conception doesn't happen. So the problem isn't estrogen itself. In the case of endometriosis, you might be overly sensitive to estrogen, overproducing it either locally or systemically, or not great at detoxifying it when needed. But that's not the whole story. New studies have found that progesterone plays a role in endo as well, specifically progesterone resistance. This is emerging research and it's really complicated, but what this means is that the endometrial tissue does not respond appropriately to progesterone signaling. That means progesterone is not able to effectively counteract the action of estrogens and suppress endometrial growth or proliferation. This may be why some women still have endometriosis, even though they don't have high estrogen. So how do you know if you're overproducing estrogen or if you have estrogen dominance because of low progesterone activity? A blood test won't tell you. The normal ranges for serum estradiol are big enough to drive a bus through. And most people with estrogen dominance still fall within these normal ranges. That's why I recommend the Dutch Complete at-home urine test. It measures all three estrogens, progesterone, androgens, and adrenal hormones like cortisol at a specific time in your menstrual cycle so that those giant normal ranges are whittled down to something actually helpful. I'll talk more about why this test is essential for folks who have or suspect they have endo after we talk about our next factor, estrogen detox and cellular proliferation. Compromised estrogen detoxification is one of the classic factors that I see in my clients with endometriosis. Basically, what the body does in order to get rid of something it doesn't need anymore, like estradiol, for example, is wrap it up into a little package by changing it slightly, chemically, over a series of several steps. But don't be fooled, there's nothing simple about the process. Phase 1 of estrogen detox happens in the liver, and it involves the formation of 3 different estrogen metabolites, 2-hydroxyestrone, 4-hydroxyestrone, and 16-hydroxyestrone. These metabolites are reactive, meaning they can cause damage to the body if they're not packaged up further, especially 4-hydroxyestrone, which can damage your DNA. But when it comes to our second factor that drives endometriosis, cellular proliferation, the estrogen metabolite we're really interested in is the 16-hydroxyestrone because it's the most proliferative, meaning that it promotes growth by rapid production of cells. Proliferation is great for bone health, but not so great for endometriosis. So if your body prefers to make 16-hydroxyestrone, you're going to be more prone to endometriosis. And studies do find elevated levels of 16-hydroxyestrone in many people with endo, especially when tested in the urine. This is one of the reasons I recommend the Dutch Complete test for clients who have symptoms of endometriosis. It not only shows you if your estrogen levels are too high, but it also shows if your phase 1 estrogen detox is making too much 16-OHE1. That's how you'll know whether or not you need to encourage a shift in these pathways, which you can accomplish using specific foods and nutraceuticals, by the way. If your estradiol shows up elevated on the Dutch Complete, promoting or pushing clearance of that extra estrogen can help lower your hormone burden and relieve symptoms. Prioritizing exercise and getting enough sleep can help lower estrogen overload. So does balancing your blood sugar with low glycemic foods, dietary fiber, protein, and healthy fats. But there are some well-studied nutraceuticals that help as well. My favorite product combines a few essential elements for folks dealing with endometriosis. First on the list is a particularly bioavailable form of diindolylmethane, or DIM, which helps clear estrogen down the protective anti-inflammatory pathway. N-acetylcysteine, or NAC, is also included. A really encouraging study from 2023 found that 3 months of N-acetylcysteine supplementation gave endo patients significant improvements in dysmenorrhea, dyspareunia, and chronic pelvic pain. These folks also needed less pain relief medication, and the size of their endometriomas actually decreased. The biggest wow of this study was that 39 of the 52 patients desiring pregnancy achieved conception within 6 months of starting supplemental NAC. My favorite endo supplement also contains curcumin and epigallocatechin gallate, or EGCG, from green tea, both of which have been shown to relieve endo symptoms at the root cause. You'll find a link to this powerhouse nutraceutical in my endometriosis support checklist. Sign up for your free copy using the link in the video description. If you're making too much proliferative 16-OHE1, you can utilize nutritional strategies to help shift towards the more protective 2-OHE1 metabolite. Grapefruit, peppermint, rosemary, and resveratrol from dark berries and cacao inhibit the detox pathway that results in elevated 16-OHE1. Sulforaphane is a compound found in cruciferous veggies like broccoli, cauliflower, cabbage, Brussels sprouts, and especially raw broccoli sprouts. Sulforaphane promotes sulfation and reduces your 16-OHE1 load. Because large quantities of these kind of vegetables can be hard on the gut, You could also take high-dose sulforaphane in supplement form. I'll include my favorite one in the endometriosis support checklist, along with the other strategies from this video. The third factor on our list that drives endometriosis is chronic inflammation. This also happens to be the biggest factor that you can modify or improve to treat endo at the root, because the higher your overall burden of inflammation, the worse your endo symptoms will be. Researchers have found that the peritoneal fluid in people with endometriosis contains increased levels of inflammatory cytokines, prostaglandins, and macrophages, all of which work in conjunction as an inflammatory storm to provide the perfect setting for endometriosis to thrive. This is also why the symptoms of endometriosis include pain, swelling, and fluid retention. These are a direct result of inflammation, or secondary to interactions between inflammatory signaling chemicals and the nervous system and immune system. Thankfully, you have lots of great functional medicine options for calming chronic inflammation in your toolkit. I mentioned curcumin earlier. A 2017 study found that it had an inhibitory effect on the growth of endometrial cells, and a 2024 study found that curcumin can treat endometriosis by inhibiting oxidative stress and improving the inflammatory microclimate of the endometrium. There's also very promising evidence for using melatonin, a very powerful antioxidant, to relieve inflammation in endometriosis. A 2013 randomized controlled trial found that women with endo who took 10 milligrams of melatonin for 8 weeks reduced their daily pain scores by 39%, their dysmenorrhea by 38%, and their use of pain-relieving medications by 80%. There's a lot more to the melatonin story specific to endometriosis, so if you're interested in another video on this specific topic, leave me a message in the comments. In the meantime, I'll include a link to my suggested practitioner-grade melatonin in the endometriosis support checklist. Link in the video description. So now you have some great evidence-based natural strategies for addressing your endometriosis. But the first step is data. By that I mean knowing what your individual hormones are doing and which detox pathways might be causing your endometriosis and making your symptoms worse. You can find ordering info for your Dutch Complete test in the link in the video description, or you can head over to my website. Once you know your specific needs, you can develop a plan to address them. And I'll even get you started with some specific suggestions once you have your Dutch results. Here's the thing. Endometriosis is an overwhelming and exhausting disease, and conventional medicine doesn't have a ton of great answers or options for resolving it, especially long term. It's not an easy thing to treat, and it's definitely not easy to live with. But you need to know that a functional medicine approach can help, especially if it's personalized and guided by solid data and comprehensive lab testing. Be sure to check out the links in the video description for all the resources I mentioned in this video, including my suggested supplements for treating endometriosis. I think you'll find them really useful. And thanks so much for being here, for supporting my channel with your likes and subscribes, and for spreading the word about the work I'm doing. I appreciate it more than you know. We'll see you in the next video.